So hi, I'm Barbara Niclario. I'm one of the health educators at the East Shore District Health Department, the health department that covers Branford, North Branford, and East Haven. We're the same health department that inspects restaurants and helps people get building permits, tests the waters at the beaches, but we also go around to give health education, and we thought it was really important to come and talk about COVID-19 since looks like it's an imminent threat in this area. So this is Daisy.
And yes, good evening everyone. My name is Daisy Hernandez and I am the Emergency Preparedness Coordinator at the East Shore District Health Department. And what I do is I make sure that our plans are up to date, well maintained, and these are all hazard plans, and we are able to respond to any emergency situation that can arise. And of course, we have a big, we have coronavirus going on, so I have been working a lot with Barbara to get out information out to the communities to stay healthy during this time.
And just so you know, COVID-19 and coronavirus are the same thing right now. This is what we're talking about. So what does the health department do? Well, the health department works with state and federal officials and local health providers. We have meetings weekly on the phone with the CDC, which is the federal government, the Centers for Disease Control, and we have a weekly meeting with the state also on the phone with all the other health departments to all make sure we're giving out the same messages, we all know the same information, and so that we can get this as right as we can. And that we can communicate if we're having problems to the state or the federal government, and they can help us with those problems, or they can bring up any concerns they have. And it just helps us all work together. We also send out information to the healthcare providers. There's guidance that's given out by the federal government and the state almost on a weekly basis because the situation is changing so fast. We work with our school and town officials. We help give them guidance on situations like this so that they know what's a proper response to this. What should they be doing? Should schools stay open? Should schools close? At what level of absenteeism would you close a school? How do they clean the schools at night? How do they clean the buses? There's a lot of different things that go into the planning and the activities that you have to do during an event like this. Disease surveillance, we also get notifiable disease reports every week. This has been going on for years and years and years. We get reports of measles, mumps, STDs, and COVID-19 has been part of that group of diseases that doctors need to report to the health department. And we record that so we know what our population is dealing with. We educate and provide resources. So exactly what we're doing now. We help, how does a restaurant deal with coronavirus? How does a daycare center deal with coronavirus? We give them guidance and help them make decisions. And we help the public to understand situations so that we can plan and not panic. And we maintain an active medical reserve corps. And Daisy, you want to tell them about that?
Yes, so at the East Shore District Health Department, we do have a local unit of Medical Reserve Corps volunteers. And what they are is a group of volunteers that are both medical and non-medical volunteers. And we get together regularly to train to be able to respond to and prepare for any type of emergency situation that may arise. On our unit, we have physicians, veterinarians, pharmacists, and they have in the past come and aided the health department. For example, in H1N1, we did have nurses that came and provided vaccinations to the community But we also had non-medical volunteers that came in, supported with paperwork and just just with the help of traffic at those clinics. So we rely heavily on our volunteers, and they have been very valuable to us.
So what's the difference between COVID-19 and the flu? So the symptoms for COVID-19, fever, tiredness, dry cough, are most common, also aches and pains, nasal congestion, runny nose, sore throat, and diarrhea. The flu, very similar, right? Fever, cough, sore throat, runny nose, muscle and body aches, tiredness. Some people have vomiting and diarrhea, but that's more common in children. So very similar. It would be very hard to tell the difference if somebody showed up to a doctor's office. Antibiotics don't work against either, because COVID-19 and the flu are both caused by viruses, and antibiotics only work for bacterial infections. There's no vaccine for COVID-19. It's being worked on, but the soonest we hear that we would be able to have a vaccine would be about 2 years from now. There is an annual vaccine for the flu every year. We still have it at the health department. We're still recommending people get it. Spread via respiratory droplets and spread via respiratory droplets. So that means if somebody's talking, somebody's laughing, somebody's coughing, little droplets are going through the air, and if you're within 3 feet, you're within the target area that person could spread that virus. The virus does not float in the air, it stays in the water droplets. Hand washing works for both of these things. And antivirals do not work for COVID-19, but antivirals like Tamiflu work for the flu. So very similar. It would be hard to tell the difference.
So preparing our community, what we have been doing these past couple of weeks is telling people to make sure that they have enough food and supplies at home in case they were to get it and they did have to stay at home for 14 days, to make sure that schools are also aware that they will be seeing students not showing up, and there will be some businesses that are short in staff because if they do get sick. So just trying to let them know of having a business continuity plan in case the situation in the community does worsen. And communities, for any large gatherings, consider postponing them for a later date. Right now, it's really tough having a lot of people all in one event and being close together. So just trying to make sure that people are aware of the risks, and trying to also keep the calm and letting people know to go on with their normal lives and not panic, because we are prepared, and just want them to know that they have the right information that they need.
So I'm not going to tell you the latest information about what states have it, what countries have it. It is changing by the hour. This map was a map, we put this together last Friday. So those orange and red states were the only states that had COVID-19 last Friday. We gave a talk on Monday, and it changed from the time we gave the talk until the afternoon. So it's almost silly for us to just keep changing the picture. But there's a global map also. If you're very interested in how it's spreading, the best website is the Johns Hopkins website. They have a live map that changes as time goes on. You can see where cases are picking up, and you can also see where cases are, how many people have recovered in those different places. We don't know the extent of the illness that's going to happen in the future weeks. We don't. We are preparing for a bad outbreak, but we hope that it will not be as bad as we are preparing for. The best thing we can do is be prepared. And being prepared means being able to make decisions now before we're emotionally upset about things that are going on. You can use your logic a little better. So before an outbreak occurs, we're asking our community to plan, act, and follow up. So this is about creating a household plan of action. Daisy, you want to go through these?
Yes. So planning ways to care for those that might be at greater risk for serious complications, meaning that there are certain populations that do have a higher risk, such as those that are elderly, and those that are also immunocompromised. Getting to know your neighbors, making sure that you have your family, that you are in contact with your family as well. Identifying aid organizations and your community and how they can help provide information for you. Creating an emergency contact list with your family members, with your healthcare provider, and anyone who you would need to be in contact with during this time. And practicing also everyday preventative actions, such as constantly washing your hands before eating and after eating, and just getting in a regular of my day. So avoiding close contact with people who are sick, and if you are sick, making sure that you are staying home, and getting the medical care that you need, covering your coughs and sneezes, sneezing into a tissue or into your elbow, and cleaning frequently touched surfaces and objects. For example, always having a barrier between your hand and an object that you're touching can help limit the exposure. And washing your hands, again, frequently with soap and water for at least 20 seconds. And if you don't have access to hand soap or water, using bacterial soap, sanitizer.
Choose a room in your house that could be used as a separate sick room if somebody in your house got sick. And that way the healthy people can stay in the healthy part of the house and the sick person can stay in the sick part of the house. Learn about emergency operation plans at your child's school or child care facility, and learn about your employer's emergency operation plans. During an outbreak, obviously stay home from work, school, and activities when you're sick. And with fever, cough, or if you start to have difficulty breathing, I would suggest that you go to a doctor or an emergency room, but call them first, because we don't want people showing up at walk-in clinics with cough and fever and sitting in a waiting room of infecting everybody else. A lot of these places will have a different entrance for people to enter if they are feeling sick like that. Keep away from other people who are sick and limit close contact. So that's my graphic up the top is 3 feet for the non-sick people and 6 feet if somebody's coughing and sneezing. That's the optimal, We can't always do that, but being aware of a distance between people is a good idea.
And during an outbreak, it's important to stay informed with the local COVID situation, and also making sure that you're receiving the most up-to-date, accurate information. Information is changing on a daily basis, and there is a lot of misinformation out there. And being aware of also temporary school dismissals in your area. Information can be found easily also by calling the 211. The State Department of Public Health has launched a 211 call information center on COVID-19 for anyone who has questions on any symptoms, transmission, and treatment for COVID-19. and they are able to answer your general questions.
And that's a live person
Yeah.
on 211 as opposed to the automated part. A live person will answer your questions for you.
Right. And again, being aware of what's happening in your community.
So I just wanted to say a word about social media and the things coming out in social media. It's really, there's quite a bit of misinformation. There's a lot of speculation. I would say if you question anything that you're seeing, check with the CDC website, check with the World Health Organization website. Both of those websites have very accurate information about this illness. During an outbreak, learn how to care for somebody who's sick in your home. Avoid sharing personal items with them, of course, like food and drinks, and clean the sick room and bathroom as needed. And when I say clean, and I mean the same with tabletops and doorknobs, first clean it with detergent and water, and then with a disinfectant like Lysol or a 1 to 10 solution of bleach, because that will help get rid of the actual virus. But wash it first, because that will help get rid of a good amount of the virus. Stay in touch with others by phone and email. If you live alone and become sick during the outbreak, you may need help, and I'm encouraging people to reach out for help if they need help. There's too many people who think, oh no, it's too much of a bother, and they wait till it's so late that they have to call an ambulance. But if you have any questions about how you're feeling, certainly call your healthcare provider. Take care of the emotional health of your household members. Both adults and children could be stressed by this situation. It's imperative to stay calm and give correct information, not try to hide things. Say, this is what's happening, and it will be all right. We will get through this. So be reassuring. Inform your workplace if you need to change your regular work schedule, and notify your workplace as soon as your schedule changes. I'm going to go back to being an employee, and you should find out from your place of employment what their plan is should there be an outbreak. Are they going to require people to stay at home and work on their computers? Are they going to ask people to, take unpaid leave? It's better to find that kind of stuff out ahead of time than to be dealing with the emotion of that in the moment. So the outbreak could last a long time in your community. We're thinking, a couple months. Public health officials might recommend community actions designed to help keep people healthy, like postponing events like the St. Patrick's Day Parade was postponed. That was announced yesterday. And maybe certain facilities will be closed temporarily. I know in other states where there are outbreaks going on right now, some of the elementary schools are closed. I know, like in Italy, they closed all the gyms, they closed, libraries, public places, so that people won't gather there.
And the following are steps to protect your children during an outbreak. If your child or children become sick, keep track of your school's dismissals in your community. Again, that's a decision that will be coming from the school. Discourage children and teens from gathering in public places while school is dismissed to prevent the spread of COVID-19, and just keeping up to date with your child's school and what are the protocols and procedures that are being taken in place.
So you're feeling sick. What should you do? Don't assume that what you have is the coronavirus. Did you have exposure to somebody who had it, or have you traveled to an area where the sickness is spread? If you have traveled to an affected area and you are sick, contact your doctor. If you suspect you've been exposed and are displaying mild symptoms, obviously talk to the doctor on the phone and he'll probably advise you about staying at home and taking care of yourself. Most people will be able to take care of themselves at home. Most people will not have to go to the hospital with this. If you suspect you've been exposed and are just, I just said that. So again, whatever you do, try not to panic. Just relax. It'll be fine, but watch for symptoms worsening, and if symptoms worsen, then you call the doctor again, and he'll advise you whether you need to go to the hospital. Most cases are going to be mild and resolve on their own, just like I said. In fact, most people under the age of 39, their symptoms will be very mild. For severe symptoms such as very high fever, severe cough, shortness of breath, seek in-person care. But again, call the doctor's office. Even if it's a walk-in clinic, don't just walk in. Call them first. So these are some questions and answers that I have run into online. So, Daisy, once you get the illness, are you immune to it?
No, you are not.
I put her on the spot there. You will have temporary immunity is what the experts are saying right now, because viruses mutate. That's why we need a different flu shot every year, because the virus mutates. Is there a cure for coronavirus? You know this one.
No, there is not. There is not a cure. This is fairly, hence the name novel. It's very new to us, and we're just learning about it as time progresses.
How about this? Will the flu shot protect you from the coronavirus?
No, it will not protect you.
But it's still a good idea to get it. Then at least you wouldn't have the flu and the coronavirus at the same time, which I believe would be really bad. So should we wear a face mask?
No, we should not. For those that are not showing any symptoms, no, as of right now, the only ones who should be wearing face masks are those who are working in a healthcare facility and those who may be sick as well.
So the whole reasoning behind that is either you have a large population all wearing the masks and the sick people not, or you have a sick person who has the mask on and it can help keep those droplets that they're coughing and sneezing in a contained area. So this is the big question I get asked the most. Is it safe to travel? Right? People are advised to avoid visiting what are considered level 3 countries. So let's see if we can name them. China, South Korea, Italy, and Iran. Those are the 4 right now. So people are not advised to go to those countries where there's widespread transmission. And will I get sick from going on an airplane? Airplanes have ventilation and have HEPA filters. The likelihood of transmission in a general flight isn't high enough for experts to recommend avoiding all air travel. And I will say this, I'm going to go off script just a little bit and say, if you are older and have underlying health conditions, perhaps you want to think twice before getting on an airplane because you are sitting so close to other people. It just makes sense that, unless you have to. And as far as healthy people, I know people who are looking forward to vacations in the next few weeks. I am saying, look at all the factors involved. What's your age? What's your health status? How much have you paid for this vacation? How much have you been looking forward to this vacation? Everybody takes their own risks, right? You all take your own health risks in life. Some people eat dessert every day. Some people, refuse to eat vegetables. Some people don't exercise. So you take your own health risks, right? So you're going to go on this vacation or not. It's a risk you're willing to take. My daughter's 23. She'll be coming home from Missouri in a couple weeks on an airplane. She said, I don't care. I'm 23. I'll be fine. You know, if I get sick, I'll just get sick a little. I'm not really worried about it. So she's willing to take that risk to come home for a week from school. And that's fine with us. But nobody can tell you at this point, flying domestically from one place to another in this country, you know, that you should or shouldn't take that airplane trip. You have to decide for yourself. Okay? I know that's not what everybody wants to hear. They want like a clear, you know, yes or no. But these are some resources for everyone. We are, of course, the East Shore District Health Department. We have a website, www.esdhd.org, or you can call us at 203-481-4233. Ask for Barbara if you want, or Daisy, or, you know, our nurses at the health department will also help you. Connecticut DPH has a website, as does the Centers for Disease Control, as does the World Health Organization, and you don't have to remember those long strings of things. You can just type in CDC coronavirus, and guess what will pop up? The CDC website, and it'll have a big sign that says coronavirus, and you just click on that, and it'll get you right to the page you want to get. Same with the World Health Organization website. So those are some very credible sources of information. And now we'll take questions. If people want to ask a question, they can go up to the microphone. I know one person has a question.
The microphone?
Right up here.
Does anyone else want to ask questions? I don't want to hide the mic. I have a few questions. The elderly, which I guess I am. I've been hearing that elderly are more at risk, whatever, but when you read about the people who are getting it, they seem to be more in their 40s or 50s. So
if they are in their 40s and 50s, they have underlying health conditions like hypertension, which is high blood pressure, diabetes. Some people have COPD, which is a lung disease, or very bad asthma. So a lot of these people already have underlying illnesses. Yeah.
And again, the airplanes, everybody always says, oh, I went on a plane and I caught a cold.
Yes.
Planes are considered to be incubators for disease, but you're saying that they're not necessarily?
The government is telling us that they have HEPA filters on there and the air is constantly circulating. And so that's the message we're giving people.
I see.
I am not comfortable sitting so close to people during an illness.
Right, because that's what you always hear. The person next to me was coughing
Right.
the whole time and gave it to me. So you would run that risk.
Yes.
Yeah, okay, yeah. And then this is a more sort of global question, like the 1919 flu epidemic. I mean, these epidemics do eventually die out.
Yes.
And how does that happen? Why does that happen?
Well, I'll tell you, with the COVID-19, our bodies have not seen this virus before. So we're all susceptible to it. They think actually that children aren't getting really sick from it because they get a lot of colds, and a percentage of cold viruses are coronaviruses, not this coronavirus, but they are coronaviruses. So their immune system is challenged more towards that kind of virus. That's the thinking people are having right now. But what can happen with these viruses also is it can end up being a seasonal thing, or it could just go through the summer. We have no idea what it's going to do. The 1918 Spanish flu, they had a spring season, and then it went away for the summer, and then started again in the fall, and then it was very deadly in the fall.
Right.
And we're hoping that is not going to happen. But viruses mutate. This virus was in an animal, but in the form it was in, it was not able to transfer it to humans. And then the virus in this particular animal mutated so that it had changed a little bit so that humans could catch it.
Yeah. But say in 1918, as I said, it did eventually die out.
Yes, because everybody had it, and finally there was a mass immunity
So
to it.
people developed an immunity even
Yes.
if they didn't get it.
Right.
Yeah. Okay. Thank you.
You're welcome.
recently heard that if you're not supposed to touch your face.
Yes.
And that was not mentioned in your presentation.
I know it wasn't.
And I wondered if that is something, how do you feel about that?
Well,
advice?
it is how it gets into you. I will be the first one to say that. It's going to get into your mouth, your nose, your eyes, because those are places where you touch. And you've touched a place that has a virus, and that's how it gets in there. I probably should put that in my presentation, to be honest. It's very hard for people, though, to think about not touching their face. One thing I heard last weekend, which was really good advice, was wash your hands once an hour. And think about that. Like, that's not that hard.
It's remembering that's hard.
It is remembering. So, like, set an alarm on your phone or something to wash your hands. I'm remembering more, like, when I get up from my desk, I go wash my hands. But, you know. But it's hard. It's very hard because it's unconscious movements to your eyes, nose, and mouth. And the more you talk about it, the more you want to rub your eyes, right?
And the other thing, I was a little dismayed when you said it'll take 2 years to get a vaccine developed for.
Yeah.
Is that
The vaccine?
How you know that, or how you?
Well,
what source?
I'll tell you. I was a scientist for 20 years at Pfizer, so I do know how vaccines are made. But I also know that testing is rigorous. And needs to be done very carefully. So by the time they have a vaccine that actually works in a petri dish, then it's got to be tested in small animals, and then it's got to be tested in large animals. Then it has to be tested for safety, and then it gets tested in humans, in humans who aren't sick, and then it gets tested in humans who are sick. So there's a whole series of tests for your safety that goes on. I don't know if you guys know any medical history, but when, I'm trying to think of the polio vaccine. First, there were a few starts and stops with the polio vaccine. I actually lost a great aunt and great uncle to the first round of polio vaccines because they were desperate to get something out to save people, but it wasn't tested as well. So that's the reason why it has to be tested, and that's why it's going to take, I would say 2 years is conservative, 1.5 years maybe,
And could you comment again on, what kind of group activities one should steer away from if you're being cautious?
Okay, if you're being cautious, you want to be... You can go to group activities if you can have 3 feet between you and other people. Think about that. Right? I had a question from a reverend up in North Branford last night because they're having a community dinner on Friday. And I said, well, how many people are going to be there? They said 45. And I said, will there be 3 feet between each person? Probably not. But again, it goes to what you're willing to risk. I would say this weekend, we're probably willing to risk a little more than next weekend or the weekend after, because it's going to get worse in the next few weeks. So this weekend's probably a little better than next weekend. Next weekend will be a little better than the week after. So I think about what you're willing to risk. And can you wash your hands? Can you keep yourself, healthy? I say get sleep, eat good foods, eat foods that have immune boosting power, omega-3s, antioxidants. Eat those things. Make sure you're getting a good sleep, and make sure you're active every day. Those are really good helpers for your immune system. I say this at almost every talk I do, don't I?
Yeah.
Yes.
Can I ask a question?
Yep.
I have a question because people have asked this at the library. When you had the comparison of the flu and the coronavirus and how similar they are, and many of us have had flu shots. And if this becomes more pervasive, and you can't say, oh, I traveled here, I traveled there, it just becomes more pervasive, and you can't associate it with some place or someone. so you're home and you're getting sick and you call your doctor's office, are they going to send you someplace for a test? Is it going to be the hospital? Is there going to be a testing center?
That's a really good question, and it's changing as we talk. Right now, the tests are being done in the doctor's office or in the hospital or emergency room. They're doing, then the test is not a blood test, it's a swab of the back of your throat and in your nose. But in other places that have this, they have opened testing centers. So I don't know what the government is planning, but we will
Because
see.
with the state of emergency declared for Connecticut, we're supposed to get more tests, and I don't know if they'll be doing them at a Quest lab.
Right, so the Quest labs will be able to process the tests, and from what I hear, the Quest labs out west are already doing it, and
That's
they're going to the places where there's a lot of outbreak right now. But I don't know whether they're doing it at the lab or whether the doctor's offices are doing them.
Okay, thanks. That is, people are asking.
I know.
They're really not sure about.
And there's questions I can't answer yet, too, you know.
Thank you.
Got to keep our eyes and ears open. But as soon as those things happen, we will know because they'll have that information on the CDC website. They'll tell us, you know, how things are going to be done. Any other questions? Okay, well, go ahead. Sure.
Only if you get infected, how long do you feel your symptoms?
Okay, so it's usually 3 to 10 days after you have contracted the
Virus.
disease to get symptoms, yes. And then within 2 weeks, you'll be through it unless it gets really bad and you end up in the hospital. And then all bets are off, like for timeline. But it's usually less than 2 weeks of actual symptoms, yes.
And is it spread any other way except the human contact?
Human contact, but when I say human contact, it could be on the table that you're sitting at. The virus can actually live on a surface for anywhere from 2 to 24 hours, depending on the humidity in the air and, you know, what happens around you.
Did you say that the virus can live 2 to 24 hours,
Yes, on surfaces.
like on these chairs or whatever? Thank you.
Yep. Which is why we're clean. You know, wash your hands and make sure you're protecting yourself, you know. I'm telling people, I know some people who are going on airplanes who are a little nervous right now, and I'm telling them to wear some latex gloves so they're not touching everything in the plane that the person who just sat there before you, that you have no idea who that person is, might have touched, right? If you're concerned, have a pocket full of tissues, and every time you open a doorknob, pull a tissue out. Use it to open and close the doors. There's a lot of different ways you can keep a barrier between yourself and those surfaces. And carry your own pen around, right?
Yes.
Don't use the pen at the bank.
No. Or those credit card screens.
Right. Wash your cell phone. Wash your credit cards if you pull your credit cards out. If you're concerned about money, same thing. Take out a pair of latex gloves and pull out your money, you know. I know. It's almost, you can get really crazy and really conservative and protect everything and hope that you don't get sick. Or you can just say, well, I'm doing the best I can. Right? Any other questions?
Thank you.
You are quite welcome.
Thank you.
And stay healthy, okay?
Thanks.
Thank you.
Good presentation.
Thanks.